We see a high incidence of fatty liver disease in people with psoriasis. It's very common, and we don't need anything else of hurting our liver. Like alcohol is only going to make things worse. It's going to make your liver worse. Your liver is already struggling if you have psoriasis. So decreasing that burden is so important. We know that there's a huge connection with your gut and your gut microbiome and psoriasis too, and alcohol affects that as well.
Dr. Mamina, it is such an honor to have you back here on the show. I'm glad you're back.
Oh my gosh, thank you so much for having me. I loved chatting with you last time and very excited to be here again.
I know. We had a great conversation about shingles, which is actually really important. I'll link that up in our show notes for those of you who missed that episode. Today, we're actually going to be talking about psoriasis, which I haven't actually focused on this in quite a while. So I think it's a really timely opportunity for us to kind of dive into this, especially because you recently co-authored a book called The Holistic Psoriasis Management and Nutrition Guide.
Yes.
And I think a lot of what I found in that book, so thank you so much for sending a copy, was really informative, really helpful, especially for people, whether you're at the beginning of your journey or you're somewhere in the middle trying to figure out what options are best for you. I thought it was really great. So I would love to start out with talking about some of the connections within your body, because most people who get diagnosed with psoriasis, it appears that many of them are not told that there are these things called comorbidities or other types of diseases or disorders that, I guess, would you say they sometimes occur at a increased rate because of psoriasis? How would you describe that?
Yes. So a lot of people think psoriasis is a skin disease, which of course it is, but it's actually, there's a lot happening in the whole body when you see psoriasis. And I almost tell patients, psoriasis can almost kind of be like a blessing in disguise. It can almost be kind of like the canary in the coal mine, because it's alerting you that there's inflammation happening in your body. And yes, you bring up a really good point. So psoriasis has definitely been found to coexist with other inflammatory conditions like cardiometabolic diseases, people with cardiac disease, so coronary artery disease. People are at higher risk for having strokes. So, your carotid arteries being affected. And then people are also at high risk of, with that, you get high cholesterol, also high chances of having obesity, and as well as diabetes and metabolic syndrome too. In general, metabolic syndrome, is a combination of different risk factors with high blood pressure and obesity and your cholesterol numbers. And they also look at your waist circumference. All of those contribute to something called metabolic syndrome. And then that puts you at higher risk for these conditions. And so it's interesting because people probably have never gotten, I'll have young patients who've never gotten their cholesterol checked or things looked at like that. And people will be more proactive about their health with the psoriasis diagnosis when it's something, a subject that we talk about in the office. And, with psoriasis too, I mean, for me as a derm, I think everything's connected. When I look at any kind of skin disease, I'm like, okay, that could be probably related to your migraines. But I do notice a pattern too with people with psoriasis. I see higher rates of things like hypothyroidism. There's higher rates of depression, and I see more hair loss. And I think that the pathophysiology and the inflammatory pathways that contribute to psoriasis, also the root causes behind that, are contributing to these other conditions as well.
So it's possible then that it's sort of like a inflammatory overlap. Yeah. Do you know what I'm saying? It's you have this picture over here, and so it might show up as psoriasis, and then maybe a few of those are going to overlap into, I don't know, like you were saying, hair loss or Hashimoto's thyroiditis or something like that, where, I had a client once who was extremely depressed. She had pretty bad psoriasis on her hands. She didn't have psoriatic arthritis, but I could just tell she was I mean, like a point of depression that was like, I'm concerned for you. Her husband was concerned. It turned out when I was like, I think you should get all these labs run, one of which was TSH. Her TSH was 33.
Oh, geez.
Yeah.
Yeah, that makes sense.
So thyroid health is really important.
Totally.
And I think most people with psoriasis, while they may be looking for these connections that you talked about, like, oh, well, it's a whole body disease. Some think it's just their skin and that it might manifest down the road as psoriatic arthritis. What do you generally see, like in your practice, in your experience with psoriasis? Are there any one or two big comorbidities that you tend to see the most in psoriasis?
I would say that a majority of my patients with psoriasis are overweight or obese. Majority, not everyone, of course, but I do see that correlation. And they're probably on medication for one other thing, whether it's high blood pressure or high cholesterol. So yes, I do see that pattern.
Interesting. So there's this like interesting picture that you're like, oh, yeah, you have this too. This kind of has started. I've also wondered, and I don't have any, I think it may have been touched on in your book because you guys covered so much in this book, by the way, which I love.
Yes, we tried to make it pretty comprehensive for anyone with psoriasis or anyone who wants to know more about it. Yeah.
And you have really wonderful patient vignettes that I think help the reader, no matter whether, you know, you're new to psoriasis, you're a parent of somebody going through this, so you're learning about this for your child, your spouse, whomever, or maybe even you're a provider of some sort and you want to understand from a more integrative perspective how this information could be helpful. I find that the patient vignettes really fascinating. I always love, like, how does this show up in real life, you know?
I'm so glad. Because by the way, that was like one of the hardest parts of the book, I thought. I was like, oh man, okay. I'm like, and it was all of the authors putting together their vignettes. But it took me a while to get all my stories.
Yeah. Your ducks in a row and everything is there.
I'm glad that it helped.
Yeah. So I wonder if too, when someone is overweight and they have, we'll just call it essentially what it is, excess fat storage, there's a lot of interesting perspectives on how that can contribute to inflammation in the body in and of itself. So I wonder if, so I think this is a good question for you. If you see a patient reduce weight, so they actually lose weight. So we're not talking like even just like maybe 5 pounds, like we're looking at a sizable amount of weight, maybe 20 pounds, 40 pounds. I just talked to a client yesterday who lost 40 pounds in the last 6 months. So I was like, yay, that's amazing. And he is feeling so much better. So do you find that weight loss does help how the severity of psoriasis?
Definitely. I think it plays a huge role. And I think you bring up a really good point because yes, fat cells like adipose tissue can contribute to inflammation. And there's a lot of other things associated with it as well. Like their diet may be a little bit more inflammatory and that can be contributing to more inflammation in the body. And like maybe they're not exercising as much and you know, movement is so important for decreasing inflammation. And so, but yes, I can't tell you, I'm just thinking right now of a patient example that I have. It's actually mother-daughter. They're adorable. They were both overweight. They both had psoriasis and they both actually got on, GLP-1 agonists. I don't know if it was Ozempic specifically, but I mean, they look like completely different people. And then like the mom ended up getting a facelift. So she looks like amazing. Cause that's one of the things with rapid weight loss is like the sagging skin that you can get. But anyways, they look amazing. And the daughter, she had pretty bad scalp psoriasis. And we have now, like over the last year, we've been tapering her off of Skyrizi, which is a biologic risankizumab. And it's, the last time I saw her, which was like in the last couple weeks, she had not been on it. it's a dose that you get every 3 months. But she had been on it for like 5 or 6 months, and everything's looking amazing. Yeah.
I just like have to stop you because I think most people have never heard that you could taper off a psoriasis medication, possibly.
Right. You like, because you're told that it's a chronic disease that you have to live with for the rest of your life. Right. And people are on biologics indefinitely. There's no like, all right, this is how long. There's no like set period that you're on a biologic. It's not like antibiotics where you're just like on it for a certain period of time, or Accutane or something like that. This is like, there's no end date in sight. And and I've been able to do that with a few patients who've been able to manage other aspects of their health. So it's really inspiring.
I love that. That is so wonderful to hear, because I've seen clients in my practice get better, but it's nice to also hear a doctor talk about that, because I think it helps make the journey feel realer for the person who's struggling with this. I do want to ask your opinion, though, about the GLP-1s. And obviously you gave this great kind of case example. Do you feel like these medications, which are like all the rage now, can they be helpful? Do you think that you have to have, like, how did they, do you, if you don't mind sharing, and obviously not, we're respecting HIPAA and everything like that, but like, what is the way if somebody wanted to try a GLP-1 and possibly wanted to see if their insurance would cover it? Like, is a dermatologist like the right person to help them with that? And so all that good stuff.
Derms are yet not, I think, as trained in that field yet. I do know of a couple derms who do prescribe it to patients, but in general, it's not in our wheelhouse. But I think as we're seeing more studies come out, because I think right now we have some interesting preliminary studies showing the benefits of GLP-1s in the setting of psoriasis, as well as another skin condition, hidradenitis suppurativa. Interesting. Both of those diseases are worsened, in situations where there is, when people gain more weight, when there's more obesity. So it makes sense that it works. And so I think there's a lot of promise to it. And I would love to be able to prescribe it. I usually would refer to that or suggest it and to the patient as a potential thing to look at. But I think that when it comes to GLP-1 agonists, I don't want them to only rely on that as their way to lose weight or help their psoriasis. I think it's important that they have other things in place for their health, whether it's incorporating exercise, incorporating a healthy, non-inflammatory diet, because I think that's when it will work the best, the GLP-1 agonist.
And what if somebody has psoriatic arthritis? Do you think that weight loss is also beneficial in that particular instance? I guess it also might depend on the joints that are affected.
Yeah, I think, we can get joint pain because of weight itself. And we see that actually, interesting, more so in things like osteoarthritis, where the actual weight of the human is affecting the joint, and that's why there's pain and inflammation. But with psoriatic arthritis, it's random joints that are affected, oftentimes in the hands, like ankles, like lower spine. And I still think that losing weight will help with that too, because as we mentioned, with increased adipose tissue can come increased inflammatory markers and all the other things associated with that too, whether it's diet, lack of exercise, etc. And because it's all similar pathophysiology with inflammation. So, and I do know of, actually, I was just talking with Dr. Tina Moore yesterday, and she uses GLP-1 agonists for people with psoriatic arthritis. She practices more regenerative medicine and helps people a lot with pain. And she I feel like is one of the experts in GLP-1, and she uses it often for psoriatic arthritis.
This episode is brought to you by my skincare line, DermaQuell. The beauty of these skincare products are that they are especially crafted for those struggling with chronic skin rash issues based on my research and clinical experience from my private practice. They focus on organic ingredients that are clean, like zinc, aloe, and hemp oil, that support and calm rashed, dry, angry skin. There's no unnecessary chemicals or additives that can further dry out your skin or mess with your hormones. And I'm so excited for you to add these creams into your routine. Check them out at quellshop.com and use the coupon code GET15OFF to get 15% off your first order. I'll put a link in the description below, and now let's jump back to the video.
Well, I want to ask you this because I think alcohol is kind of another complicated, it's a complicated relationship with psoriasis. And I oftentimes get the question, do I really need to go cold turkey and cut it all out? Or is there some wiggle room here? So what are your thoughts on alcohol consumption if you have psoriasis?
I mean, for me, so for those who don't know, alcohol, we have a lot of established evidence that alcohol worsens or can trigger psoriasis flares. And that could be for many reasons. And it's been shown even a small amount can affect psoriasis. So in an ideal setting, yes, it's hard to go. I know for many people it's hard to beat cold turkey, but alcohol just sets off this whole inflammatory cascade. It sets off certain inflammatory markers that play a huge role in psoriasis. Like one of the biggest ones is TNF alpha. And so even a small amount can affect psoriasis. So yeah, it's one of those things where you just got to weigh the pros and cons. Like, do you want to have psoriasis, or do you want to have just a tipsy fun night out? I don't, you know what I mean? It's whatever is a priority for you. And I think that it's much better if you just have a random, if you drink sporadically here and there, as opposed to drinking chronically. That's where we're seeing way more issues. But abstaining altogether would ideally be the best. And the other thing with alcohol is we see a high incidence of fatty liver disease in people with psoriasis. It's very common, and we don't need anything else hurting our liver. Alcohol is only going to make things worse. It's going to make your liver worse. Your liver is already struggling if you have psoriasis. So decreasing that burden is so important. Yeah. And then we know that there's a huge connection with your gut and your gut microbiome and psoriasis too. And alcohol affects that as well. So yes, it's tough. And it's kind of cool though. I feel like there's been this trend, at least in this country, I feel like, and amongst younger people, of people moving away from alcohol events being alcohol free, and people turning towards other things. Sorry, like other fun activities that don't need alcohol,
Yeah.
So.
Yeah. I mean, I also sometimes think too, because my husband and I don't drink very often. And I remember in earlier days, I always kind of felt like, oh, we're going out, you have to have a drink. And now I mean, we have a wine, we're part of a wine club, and we have so much wine downstairs. I'm like, we don't ever drink this. Yeah. Because for me, I don't care what I'm drinking. I don't need the drink to be the thing that makes socializing easier, or a dinner. If I'm going to have it, it's because it's a special occasion or whatever. So I might have a glass of wine once a month, maybe. And so I think I think it's worthwhile to ask the question, if you really feel like you can't go out without having alcohol, or you can't, it's one thing to go, well, I enjoy it, I like it. I totally understand that, but everything that we like is not always good for us. And if you're really struggling with stopping, that might be an opportunity to speak with somebody about what the reasons are that are kind of preventing you from making that change. Because I think it's a helpful thing. And I'm so glad you brought up the fatty liver issue, because the liver comorbidity problems is so significant with psoriasis. So. And alcohol is already hard enough on your liver as is. It also, depending on how much you consume, will deplete a lot of nutrients. And we already know that there tends to be a lot of nutrient deficiencies that show up in psoriatic cases. So I just think it's like a storm, a perfect storm, so to speak.
Yeah, totally. And you were talking about your decreasing alcohol or not having it as much. After I got pregnant, I abstained altogether. and it wasn't even like I was drinking that much. I was just drinking for social reasons and it ended up being like a couple drinks a month or something. But after abstaining and then just through breastfeeding, I was like, I'm just going to stay away still. I mean, I feel so much better. And it's not like I even drank that much, but I just think everything is so much better.
Yeah.
Health-wise.
Health-wise. Yep.
Yes.
Yep. Well, and also I wanted to ask you about phototherapy because I think sometimes patients might not be told about this. And then there's all these different like light units that you can buy on the internet, especially with the rise of like red light therapy and the popularity of that. But like they get them mixed up. They're like, is UVB light the same as red light? So can you talk a little bit about the different light options and what you know and see has been most helpful?
For sure. I am a huge fan of light therapy. And I love that you're bringing this up because yes, a lot of patients don't know that it's an option for psoriasis and it's something that like insurance can cover kind of treatment option. It's a prescription and it is great because you don't have to worry about like any internal immunosuppressive systemic side effects. It's literally light treatment. And there's different forms of it. The most commonly prescribed form of light therapy it's like you're standing in a light box. It kind of feels like a tanning bed. You're standing in it. And I want to be very clear about what light therapy is because it's very different from sunlight. It's very different from tanning beds. Light therapy for psoriasis uses a specific wavelength of UVB light called narrowband UVB. It's 320 nanometer wavelength. And this wavelength targets a specific layer in your skin where there are certain immune cells that it affects and modulates, decreases so that you're having less inflammation in your skin. And it's great because it's not the wavelength that contributes to skin cancer. So, the sunlight does have this wavelength in it. That's why sun also helps with skin. And then sun helps with vitamin D production and metabolism too. So that's how sun helps with psoriasis as well. But light therapy is great because it's this targeted wavelength that really targets that specific layer in the skin that is responsible for a lot of the inflammation with psoriasis. There's also PUVA, which is a specific wavelength of UVA light. That one, not all centers or clinics offer that because that one's for more severe cases and like you do have an increased risk for skin cancer with that one. So the traditional one is with UVB. Now, not all derm clinics have light therapy in their practice. Larger centers do. When I practiced in DC, we had it there, but I don't have it in my current practice in New Orleans. But what's really interesting, if your dermatologist doesn't have it, you should definitely ask your dermatologist about having a device at home. You can get a literal light box. It looks like a tanning bed in your home. You can also get handheld devices if you have like localized psoriasis. If you have full body psoriasis, I do recommend the full body like light box treatment. But yeah, if it's just on your scalp or just on your hands, you could also get like a type of wand where you could just focus on the areas. And insurance can cover these things. It's kind of annoying as a derm. We have to fill out all these forms and stuff, but it exists.
Yeah. One of my clients recently was able to get this, she said it looks like a comb or a brush, and it's a UVB wand that she can move over her scalp because she has scalp psoriasis.
Nice.
And it was completely covered by insurance. So she was pleasantly surprised, and her derma never suggested it. She had heard it. Dr. Jenny Bennett had talked about this on the Healthy Skin Show in a previous episode. And so she went and asked her derm, and she was like, oh my gosh, I got this device and it was totally paid for by my insurance. So I think these are helpful things. Do you think that red light therapy is as helpful, or is it helpful in a different way than these options?
Yeah, I think theoretically it can be helpful. I don't know of any studies of it specifically looking at it in psoriasis, but we do know that red light helps with inflammation in the skin. And so I could see it being potentially beneficial. I would love for there to be more studies with it. I don't think it hurts to
Right.
use,
Right.
but they can be pretty expensive. So I would just, look into getting an insurance. If you have psoriasis, I would try to see if insurance can cover something that we know works for sure. But if you have a red light mask hanging around or a LED, whatever panel, I mean,
Yeah.
I don't think it hurts.
I don't think it hurts either.
Yeah.
My preference is always to get one with both infrared and near infrared. And I'm like,
Mm-hmm.
why not turn it on at the same time? It'll help more deeper tissue and it'll
Yeah.
help the skin. So why not?
Yeah. I mean, we definitely know that there's data that it can help with arthritis. I don't know
Yeah.
which forms of arthritis, but yeah. So it seems like it would be great for psoriatic arthritis.
Well, another thing I wanted to ask you in terms of just like treatment, and this is where I think sometimes people get overwhelmed because they'll go to their doctor, they're really struggling, right? They might have tried the diet thing, they're trying to do a lot of different things, but they're really struggling. And obviously then if we start having joint involvement, that's a kind of like totally different situation altogether, and I think increases the urgency for a higher level of intervention. What should someone who has no knowledge of medications, right? You're trained on this. There's immunosuppressants. There are now these biologic drugs. There's Otezla, which I feel like is kind of different. Like, what should somebody know or consider or ask if their derm, or even just they're thinking like maybe they need some medication to help them?
Yeah. So when it comes to prescription medicines for psoriasis, it definitely depends on the extent of psoriasis that you have. If it's very localized, you can get away with topical treatments, and we could kind of briefly go over the different types of topical treatments there are. And then if you do have, like, I would say if you have more than 10% body surface area, you definitely would qualify for a systemic medicine. And yeah, so think of like the palm of your hand is like 1%. So think 10%, 10 palms worth of body surface area. And then like if you have scalp psoriasis too, of course there's topical treatments. If it's pretty severe, topical treatments can get really annoying for people to use on their scalp. So this is where systemic medicines would become more helpful. And then if you have psoriatic arthritis, if you have nail involvement, psoriatic nail disease happens in about 30% of people with psoriasis, then systemic medicines are going to be more effective in that regard. Now, when it comes to the types of medicines they all are essentially anti-inflammatory medicines. So with topical medicines, the most commonly used class are steroid medicines. We like these because they work pretty quickly, but they are not a good long-term solution. So if you ever are prescribed steroid creams, you can use them. We usually say like for up to 2 weeks and give it a break because it can thin out your skin. And also, like if you do have a lot of body surface area, which is another reason why we say it's better to do systemic, but if you do have a lot of body surface area, like you can absorb it systemically. You can absorb the steroid systemically, and that's worse for you than biologics actually. And yeah, systemic steroids we never do for psoriasis actually because people get really bad rebound psoriasis. But topical steroids we do a lot, and then there have been, fortunately, in the last couple of years, like 2 new non-steroidal creams that have come out. Prior to that, we would use this class of medicines called calcineurin inhibitors like tacrolimus and pimecrolimus, which were great because they weren't steroids. They didn't work as well as steroids. They weren't as fast acting, but they were great for maintenance. And then vitamin D creams, vitamin D analogs like calcipotriene is something that we would also use often with psoriasis. But yeah, in the last 2 years, there's tapinarof cream and roflumilast, which is Zoryve.
Zoryve, I was going to say I have a client on Zoryve, yeah.
Yeah, and those work very differently, but those are nice options for patients. And there was another one. Oh yeah, tazarotene, which we think of as for acne or for anti-aging, but psoriasis is a disorder where you have like abnormal keratinocyte proliferation or skin cell proliferation. So that's why you see these thick scaly plaques on the body and the scalp. So Tazorac helps regulate that like skin cell proliferation. So that's also another great topical treatment option. But I usually kind of put out the fire with a topical steroid and then like maintain with a non-steroidal. And then if you have psoriasis on your scalp or like in areas with more moisture, like your armpits or your groin, I also do like a topical anti-yeast product. something like a shampoo for the scalp, like ketoconazole shampoo or ketoconazole cream for those areas, because yeast is a huge contributor as well to psoriasis.
On the skin, like topically or internally?
Well, I think that there's probably yeast overgrowth in the gut, but definitely topically.
I agree.
Yes, yes.
I agree.
That's another mechanism, I think, behind alcohol too. Like I think alcohol can worsen like the yeast load in the body and on the skin, and sugar as well. So I talk about that a lot with patients, but yeah, so an anti-yeast product topically.
And what do you think of like the biologic medications? Like,
Yes.
how do you feel about them? What's your experience been?
So, let's see, I've been treating patients for like 16 years. And initially, when it came to biologics, we just had like the TNF alpha inhibitors. There was like an anti-IL one. But anyways, the TNF alpha inhibitors, so the two most popular ones that you've probably heard of are Humira and Enbrel. And those were like the mainstay treatments for psoriasis. But those came with issues. Like those could increase your risk of certain cancers like lymphoma and skin cancers, which is frustrating. And then like we also had to really monitor blood work closely with them. We have to monitor your liver, hepatitis, check for hepatitis. We have to monitor your tuberculosis status. These were more immunosuppressive. When you block TNF alpha, you're blocking a pretty large portion of your immune system. And it's been amazing in the last 10 years. We've had like an explosion of the newer generation of biologics, anti-IL-17 and anti-IL-23 or 12 and 23. And these are things like Cosentyx and Taltz, secukinumab and isrikinumab. Gosh, it's a whole nother language.
They are. Sometimes it's a mouthful.
It's so hard. And then there's like Skyrizi, which is risankizumab, and there's Tremfya, which is guselkumab. And they have been a game changer. And I think people kind of have a bad taste in their mouth because they've heard like probably bad things about Humira and Enbrel, which are still great drugs. But it's funny, I never prescribe those now, because not only are these newer agents way more effective, like you can get 90% to 100% clearance with these guys, which, you wouldn't get with Humira or Enbrel. And the safety profile is so much better. We still check tuberculosis status just because it was something carried over with the TNF alpha inhibitors, but it doesn't really increase your risk of tuberculosis. It doesn't increase your risk for cancers. It's still technically an immune suppressant, but it blocks a specific immune marker that is a smaller part of your immune system. So it's less immunosuppressive. But yeah, it's not something I would take lightly. It's something that, you still have to have a good discussion with your doctor. They still should go over all the side effects with you. But I thank God every day for these newer generation biologics, because I feel so much better, like just in my conscious prescribing them. And because they're just way safer. And what was the other thing I was going to say about them? And also the dosing schedule is so much better. Like they're every 2 to 3 months, which makes your quality of life so much easier. You don't have to like take this medication every day. For people who don't or are scared about immunosuppression, even just the small immunosuppression, there's medicines like Otezla, which are not considered immunosuppressive. They're actually considered more immunomodulatory, which is less scary sounding. It's funny. I think there's more side effects with Otezla though than biologics. One of the biggest side effects is GI symptoms like diarrhea. So I would just be cautious if you're prone to that. Also slightly higher risk of depression and migraines. Speaking of GI stuff, if you are prone to inflammatory bowel disease, which I think more patients than they realize.
Yep, there's a big connection there.
There's a big connection, and it's all connected, But I think so. The anti-IL-17 biologics that I referred to, Cosentyx and Taltz, potentially can increase the risk for IBD. So we stay away from those and those who are at risk for that. But otherwise, most people are great candidates, even people who've had a history of cancer, which we were scared to do with Humira and Enbrel, but now we're more okay with the newer agents.
And can I ask you, so if someone has, let's say they're covered pretty extensively with plaques and they have a diagnosis of psoriatic arthritis, what would clear or improve first? And can you have improvement in the joints if you go on these medications? Because I will say, we've said before on the show that the medications will save the joints. It will like sort of stop the progression of damage because we can't fix the damage that happens.
Yeah.
So I want to underscore that because I think sometimes people with psoriatic arthritis think that there's like, well, I can get it back. And it's like, no. Unfortunately, we're not there.
Yeah.
So what's your thoughts on that in terms of like, what would most likely improve first? What would a timeline kind of look like? And can the joints, like maybe if you have a lot of pain, would a biologic help the joints be less painful?
Definitely. These same biologics I mentioned, the newer class, definitely, Humira and Umbrel have been used extensively with psoriatic arthritis, but the newer class agents, we have now studies that those are also very effective in psoriatic arthritis. So a lot of rheumatologists are prescribing it for patients with psoriatic arthritis. I mean, I will prescribe it, obviously, if patients have both like skin and joint disease. Sometimes with psoriatic arthritis, I forget which medicines it is, you do need slightly aggressive dose. So it can be a little bit more stubborn than regular psoriasis, but both can clear pretty easily with biologic treatment. And the timeline varies. It usually is within like 2 months, which is amazing.
Oh, wow.
Especially, definitely with the IL-17s, that's really fast acting. And then, 3 to 4 months with the others.
Yeah.
So
I think one thing that's also helpful, and I would love your perspective on it. My experience has been, but obviously I'm a clinical nutritionist, so I'm not prescribing medications. I'm not advising clients on medications. There's times where I'm like, hey, I think we need to like talk about, you got to go back to your doctor. Like you're really suffering. Sometimes I'm the person initiating that conversation because I know they really want to do it naturally. I get that. But it's also quality of life, right? And then with
quality of life, yes.
Yeah, and with psoriatic arthritis, this is a whole different
the erosions, like you said, can be permanent. So so important.
So my experience has been that even if someone goes on these medications, we can still do so many integrative things that are driving inflammation under the surface while you are on these meds. What's your feelings on that?
I am all about it. And yes, it's like, that is my love, my passion is integrative medicine. It's like, let's try to get you to feel better, both just mentally and physically with these medicines. And because while we like fix your gut, while we do all these other things to get your life back on track in whatever way it is, because those things take so much longer. Like fixing the gut takes so much longer. And like
it does.
And it's also, how motivated the person is to implement all of these changes. Some people, like, it takes a while. So before more damage is done, whether it's with the joints or before, like, so that you can feel confident to go to like, go outside in shorts. And, it's the conventional medicines play such a huge role with that. Like people, like lives are changed. People are so much happier. But I think it's so important that while that's happening, now that you feel better in that way, I think a lot of, it motivates people to work on these other aspects of their life. So I think these meds play a huge role with that.
Yeah. And I love the fact that you are in alignment with that idea that like we could use the meds if we need to improve quality of life, while at the same time being able to utilize a lot of these integrative strategies. And I think I need to say it again because I thought that was so amazing that you shared that it is potentially possible down the road to possibly wean off of these.
Yes, totally.
I think that gives people hope.
Yeah.
So I want to make sure that people can connect with you. Obviously, you've got a huge following. You're on TikTok and Instagram and YouTube. I'll make sure to put all of your links up so people can connect with you.
Thank you.
And then we've got your great new podcast that you're doing called the Skin Deep MDs podcast. So we'll put a link to that. And then you've got this book called The Holistic Psoriasis Management and Nutrition Guide, which is available now. And we'll put a link to where you can get it because I'd imagine it's pretty much available everywhere.
Yes.
So
thank you.
Thank you so much for sharing all of this today. I really am so glad that you were able to come back to the show. And I really appreciate your enthusiasm for blending options and giving people more options than just it's this one way and that's it.
Yeah, no, I loved all your questions. And I think that having discussions like this and people to hear these discussions, I think gives people more hope and just more knowledge and feeling more empowered to get the right treatment for themselves. So thank you so much for having me.
If you enjoyed this video, you need to tune in to this video next. Then make sure to hit the subscribe button so you get notified as soon as a new episode drops. I'm excited to see you there and dive deeper with you on your skin healing journey.